Without further ado, allow me to please introduce on stage Dr. Mars Sheikh, the Associate Director, Project Management of M42. Thank you. Please give him a warm welcome. Over to you, Dr. Mars.
Good morning, everyone. Hi, good morning, everyone. And thank you for making it to this early morning discussion. My name is Mars, and I'm going to talk a bit about how M42 is leveraging the power of AI to unlock infinite possibilities. Right? Zooming out, M42 is one of its first kind of healthcare companies in the world. What makes it unique is the combination of globally competitive, so slide, no, yeah. M42 is what makes M42 unique is its combination of globally competitive technology prowess, AI capabilities on one side, and the ability to connect to hundreds of facilities across different countries, regions, and thousands of clinicians. Right? What this platform offers is the ability to discover, co-create, and test innovations, technological innovations using AI, and implement them at scale. Right? An example of one of these initiatives is Med42, our clinical large language model. Right? Designed to be a trusted companion, a trusted assistant to patients, providers, nursing staff, and other stakeholders in the healthcare ecosystem. Right? The motivation behind creating Med42 was to be able to transform population health at scale, right? Be able to set the benchmarks of implementing AI meaningfully and in an ethical manner. More importantly, being able to empower the physicians and clinicians to use information better and make better decisions. And lastly, to be able to empower research and discovery. These motivations combine with our access, with our in-house talent, a bench of highly skilled biomedical AI experts, and our partnerships with leading academic and technology organizations, including biotech, and access to our premier network of hospitals, uniquely positions us to be able to create uh, technological innovations that we can deploy in the real world. And, our approach for building Med42 has been to work with an open source platform, a 70 billion parameter large language model, and retrain it on clinical data, a corpus of more than 250 million tokens, and retraining it with thousands, 700,000 instructions to train and bring in the medical knowledge to the LLM using one of the most advanced supercomputers available in the region, right? And then evaluating it rigorously, subjecting it to testing, evaluation against known standards of care. The result was Med42. Right? We compared Med42 to the existing open source and models available. And if you see, these are the performances of these models across on the US MLE licensing examination, which is the medical licensing examination for United States. Med42 performed significantly better. We scored 72 percentile on the score on the evaluation, which is higher than the cutoff required to clear the examination. It takes a doctor to score at least 60% to be qualified to practice medicine. We scored 72%. Right? Going beyond the available open source and academic models, we compared the performance against some commercial models as well. And of the known models for which data is available, we perform better than most available models. We've got 2 models ahead of us, but summarize, Med42 is the only open source model with results available for evaluation validation. Med42 empowers stakeholders across the healthcare value chain. To start with, patients. It can help patients understand complex medical information, understand their medical records, like including things like on the complex side of medicine, like genomics, to be able to understand that, consume that information, and act accordingly and make better decisions. It can help clinicians access information, not just access, but also consume that information in a meaningful way to, again, make better decisions. And lastly, researchers and scientists, it can empower them to move faster in their research efforts by being able to access this information, access the current known knowledge, and deploy it faster and quicker to run studies better. And that's just the beginning. There are many, many use cases. If you had to go down to some important ones, I would say, let's start with medical text summarization is a use case. The amount, as we grow, as health information grows, it's going to be more and more difficult for providers and doctors to be able to access this information, consume it meaningfully while they're treating a patient. Med42 can help with that. Medical text generation. Clinical documentation has been a pain point for physicians around the world. It is one of the most common reasons quoted for physician burnout. Med42 can help with that. And likewise, there are other use cases where Med42 is significantly better than the currently available solutions. The way we see Med42 is as a platform to catalyze innovation in healthcare globally, right? But more importantly, prioritizing the safety of patients over all else. The core ethics that drives our ambition of building this platform are collaboration, open access, and transparency. We continue to work with our key partners from technology, infrastructure, and research, and many more new partners who would join us in this journey. We continue to improve the safety of Med42 through extensive studies to evaluate its performance, benchmark it against existing known evidence and current practices. While we are doing this, we continue to add more capabilities and features. For example, we've recently introduced a new update which you can experience on our booth, to the ability to cite references from evidence for the recommendations. We are expanding these capabilities to include Arabic, bring in guidelines and clinical evidence from around the world. And based on what we do really well, the genomics, we are integrating this with genomic databases to be able to kind of interpret genomic information better. And that's just the beginning. Our ambition lies in building this platform to be a truly multimodal generalist AI platform, to building Med42, building multiple different, going beyond the large language models to building foundational models in imaging, in EHR, genomics, so that we can bring all of these together to truly empower the patients and physicians. Thank you, everyone. You've been a great audience. We've got, as Aman said, we've got the booth behind where you can interact with the system. But before I leave, I will leave you with a video that summarizes our journey so far, but with music and little dance. Thank you.
Thank you.
Thank you.
A new era to access medical knowledge, insights, and analysis has emerged. Med42 is a new generative AI platform built for enabling healthcare professionals and patients globally to easily decipher medical reports, rapidly analyze test results, streamline and improve their care experience. Med42 unlocks limitless possibilities for the healthcare community globally. Built in Abu Dhabi by M42 and powered by the world's largest supercomputer for AI model training, with our partners Core 42 and Cerebras. Med42 is open access and was trained using a curated dataset of industry-leading medical knowledge. Med42 embodies our commitment to impactfully disrupting the healthcare landscape, realizing our promise where innovation meets health.
Thank you so much, Dr. Mars, for that very insightful presentation. Now we have a whole tech team who are going to be mingling with you and inviting you to enjoy our refreshments this morning. Please do make the most of our interactive display. And Matthew and Francesco in particular will be escorting you and navigating you through the Med42 journey. Please do enjoy your time with us this morning and stay on for our full day of programming. My name's Amandeep and it's been my pleasure to welcome you here for day 2 of Arab Health. Thank you very much.